Do we have anybody that has any comments? I saw Barbara may have a comment, and I don't know if Mark has a comment, but Barbara, do you want to go first?
Sure. So I just want to invite everyone to the farmers market this Saturday. It's from 10 to 2. So the area group has a table, and we are collecting for the Lions Club. We gently used coats, like winter coats, just so they can help for those that are not able to afford them. So everyone feel free. I'm sure if we look in our closets, we'll have one that we're not using. Just come drop them off at the farmers market this Saturday. Thank you.
Thank you.
And Ron has just joined us.
Hey, everybody.
Ron, we just...
Sorry, Ed.
Yeah, that's
Sorry,
right.
everybody.
That's right. We just started, Ron, and if you'd like to take over, we're just at citizen participation.
Okay. All right. Ed, thank you. Sorry I'm late, everyone. Thought I could make it home. Traffic told me otherwise. So thank you for helping out. Just trying to get my agenda up here. That you would think that, but it isn't anymore. Hey, well, I just lost it. Hang on. There it is. Okay. So the citizens participation. Okay. All right. Mark, how are you? I know you want to citizens participate.
I kind of waited until the doctor was in.
Okay. There you go. I'm sorry the doctor was late.
No, I got enough patience for you.
Okay. Very good. Like that.
Appreciate it. I know. This is for all of the board members, if they can say that this town is still COVID, aren't they? Yes or no? Any news, any reports to say about any sort of COVID reports?
Mr. Mark, you're saying COVID, right? COVID?
Yeah.
Yeah. So I'll be updating more in my agenda, but numbers are low at this point, but we don't have the true data. That's why we have stopped sharing, because a lot of people are testing at home and not reporting. But so the numbers we are getting are very low. Okay. So not a whole lot. So.
Okay. So that's one thing. One quick thing, and I know what's on the agenda is the flu clinic. How that was running, and I was told you had another one recently.
That is correct. So for the season, this is our third clinic. It's going to be happening from 10 to 1 tomorrow at the community center. I'll be briefing more during my agenda again. So
yeah, and to the board and whoever listens and watches the broadcast over at WACA, I'm just going to say everything's well here at the house. My dad's resting comfortably, doing better. And I got all the shots to get in the shots, the flu, COVID, and everything else that you saw me at the last flu clinic. And just going to come up and say to all, have a good holiday coming up. And there is a town meeting tomorrow, and it's not really much on the health issues, but going to see how this town is going to react health-wise. Thank you, and that's it.
Okay. Thanks, Mark. Anybody else? No? Okay. Hang on, I just want to change this view for a second. Okay. All right, moving on to item number 3. Jay, you got an update for us for remote area medical?
Yep, we got a few updates.
Okay.
The CHG Community Host Group team, myself, Ed Berman, Steve Mitchell, and Ed Hart, we attended the RAM clinic for a few hours on Saturday, October 29th in Lynn. You may remember that they had a clinic running for the last week in October. And it went well, and it was nice to see it. We also, Ed Hart and I, helped with the setup of that clinic on the prior Thursday night. and that was interesting too. They saw, this is an estimate of, I think they saw over 170 patients over the weekend, and they provided just over or close to $70,000 worth of care. That doesn't include the volunteer time. So that was just services across dental, medical, and vision care. But they provided all of the services that they typically do, all of those areas, including providing glasses. They had the mobile eyeglass unit there that was grinding out prescriptions. So it kind of got off to a sort of a slow start. I'm not sure if that was because of the advertising or that people in the area don't have cars, so a lot of people were walking. We were there, our group was there probably until around 12:30 or so, and then I was checking in real time how the clinic was doing, and at about 2 o'clock on Saturday, they just got this massive influx of patients. So that was good. There's also going to be a debrief with that community host group. I'm not sure when that's going to be, and I'll have a chance to ask some questions about some of the logistics. But it went well, so I was happy. Another critical piece to that is that the clinic got a dental license, an area dental license that I guess you need in Massachusetts to have these mobile pop-up clinics to provide dentistry. And that license is good until it will cover our clinic. I think it's good for 18 months or at least a year. And that was kind of a process. They needed to be inspected. It was really a last minute thing. So there's a whole story behind that, but we're good, fortunately, because of the Lynn Clinic. Also, since the last time this board met, we've had meetings with Framingham State University to discuss what we're doing and some of the needs that we've got. And it seems like they were very cooperative, and I think that they're going to be able to help out around the hospitality component, maybe housing some of the folks that come up with the RAM group, as well as connecting us with the some of the professional services, not only hospitality, but student services, as well as professional services like the nursing program. So we're still waiting to hear back from them. We'll regroup with them, hopefully in a couple of weeks. We also met with Karen Spilka's staff that provided us with a really helpful list of resources in the community and has offered to help us reach out to them for a number of things, mostly in the realm of with groups that are already providing free medical care in the area. We also met with the Foundation for Metro West, and they've agreed to be the fiscal agent to hold our donations and the money that we're going to need to run the clinic. That's in the works, and a woman there in particular, Caroline Murphy, has offered to provide any help we need as far as connecting with other resources in the area. So she's adding to that list that Karen Spilka's group has given to us. So that was really helpful and very encouraging. It seems like everybody's on board and wants this to happen. Let's see, I made some notes here. Next steps. Well, we're just going to continue to try to raise money, maybe write for some local grants, and continue with recruiting efforts. And Ed Berman, let me know if I'm missing anything. I know that you've reached out to several people. I don't know if you want to talk about that. Fire, police, etc.
Yeah. So I actually attended the, because I'm on the board of the Metro West Regional Transit Authority yesterday. So I kind of put the placeholder for them that we might need some assistance with transportation. I need to get back with them with more info as things get closer. Also, one of the things that I did at that board meeting, because there's representatives from all the towns, including Framingham, I actually sent out to everybody there the link for RAM and asked that if they know any groups in their communities that would be interested in having us volunteers, so the link so they'd have people to be able to sign up to volunteer. So hopefully we'll get some additional people from there. And I also did meet with the superintendent of Keefe Tech to get them on board with their dental program with the kids to be able to help dental. early childhood, maybe if there's any babysitting that needs to happen for any adults that need care, and also the nursing program.
Excellent. Thanks, Ed. That's huge. And that reminds me, Laura, I can send you the link for the RAM volunteer site, just so that we have it documented, maybe in the minutes.
You want it on the website, on our website yet, or not yet? I mean, not like the actual clinic, but like information, like
definitely.
Something.
Yeah, there's no limitation to where we can put that. So certainly you can put it there too. I think it's ramusa.volunteer.org or something like that, but let me just double check and I'll send it to you.
Okay, sounds good.
One of the things I was going to ask Raj, Raj, I don't know if you have a chance. I was wondering maybe if you could talk to Mike Herbert, and maybe we could get the information out in one of his weekly newsletters about us needing volunteers with the link. That might be really helpful, both medical and non-medical people.
Mr. Berman, yes. So in fact, we did had a conversation about this, in our Monday meeting, with the directors meeting with the manager. He asked me, like, what all we need to do, yes. So we'll definitely put that there, so once we have the information, but yes, the communication is going on.
Excellent.
Thanks.
Thank you.
And Jay, the only other thing I was going to do, I was going to talk to Jim Adams to see in one of his weekly newsletters, maybe in a month or two, if he could put that out also, because there's some parents that are nurses, doctors, maybe they'd be willing to volunteer also.
Yeah, that would be great. I did send Jim an email. This was back in the summer, but he was on vacation, just letting him know that we were doing this. And actually at that time when we weren't sure whether or not Keep Tech was going to work or not, I just wanted to give him the heads up and, kind of feel out whether or not Ashland High School might work. But so he might be aware of it anyway, but that would be really helpful. And I'm not sure if you said this, Ed, or not, but you also reached out to the mayor. Did you mention that?
Sorry, yes, I did talk to the mayor yesterday. And I did actually, and yesterday, sitting next to me at that meeting was the number 2 in Framingham, Mike Tassino. So he's on board also now. And what they're going to do is they're in the process of hiring a new health director. And once that happens, he's going to connect you and I with that health director to get them on board.
Excellent. All right. It's all coming together.
Yeah.
Thank you.
That's awesome, Jay. And Ed, thank you both very much. That's a ton of work that you just put in over the last few weeks. That's for sure. So what were, just because I didn't remember that you were actually going. What do you think of the Lynn Clinic?
I thought it was great. I was a little concerned at first when when we got there, it was really slow. And since a lot of people are on foot, not driving, the parking lot was mainly staffed by volunteers. I'm filled with cars from volunteers. So, I was wondering how it was going to go down. But because it was kind of slow, we had the opportunity to tour the entire place and see the inner workings, if you will.
Yeah.
And then it was just good to hear that after we left, there was a large influx. So I think it went well. I think that they were happy with the turnout. The volume that they could have handled was up to maybe 300 or 400 people. Mm-hmm. So they got, about half of that. And I think that was good. Not uncommon for a first clinic in a community. So, and my understanding is that they'd be open to doing it again. Yep. So, yeah. So what'd you think about it, Ed?
Sorry, my mute was stuck. No, I thought it was good. Again, and Jay, I honestly think that their lower numbers were because of the location more than anything. I think that's what it was, so far into that neighborhood, and away from the bus routes and everything. I think that was one of the issues. I think that was probably the main issue, the location.
Yeah, that makes sense. I think that this will be different. We've got already there are several groups in our area that do this kind of thing. And the message that we've been trying to send to the people that we're talking to, like the Foundation for Metro West, Framingham State, and I should also mention we should be setting up a meeting with Jack Patrick Lewis. Steve Mitchell is going to set that up with us if he hasn't spoken to him already. But the message is that we're really here to augment the services that are already available, not to replace them. I mean, there's no way a group can come in for one weekend and replace services that already exist. So in that spirit, I think it can be a nice community event. And to your point, Ed, I think that we have a lot of resources to draw from, and I think it'll be a success because of that. So,
Dr. J, I just want to add a point, like at the town level, as well as the shared services, we have a very good communication team, so if we have to put it out, like in different languages, we can do that, about the clinic, about the services, can do it at the town level as well as the shared services, So we have like 2-3 people who are like communication specialists, in the shared services team, So we'll definitely, because this is going to be a kind of a regional effort, we'll use all that resources we have in hand.
Mm-hmm. That'll be great. And I think that the way it'll probably end up, kind of developing is that, once we get the fiscal agent all set and we can begin to get money going into that account, then we can really focus on, Steve Mitchell will be focused on hospitality and Ed Berman on recruitment, Ed Hart on promotions. And then I'll, be talking to you, Raj, as, maybe at the beginning of next year, more and more about how we can start to implement some of that stuff. So I think we're really in good shape now.
Yes, sir.
Yeah. So,
and Jay, just a question: what are the different medical disciplines that are focused on? Is there primary care there? So I know there's dentistry. Are there pediatrics? Were you giving vaccines? Like we give the kids, that type of thing.
Mm-hmm. Yeah. For vaccines, the plan is to have a vaccination clinic.
Okay.
And I'll defer to Ed Berman here on how that will work. But for disciplines in medicine, it's usually general medicine. Most clinics have a women's health piece. So the Lynn Clinic had 2 women's health specialists, full exams, labs. And then it's really a matter of who is available, who signs up to volunteer at the clinic. It could be podiatrists, dermatologists. There have been some orthopedic folks at various clinics. So, and then, if we know who is going to be there and what specialty, we'll advertise for that. We'll let people know that there's a group of podiatrists. We should have that plan. I would say by June, we should know exactly who is going to be there. I think we can talk offline to you, Ron, about maybe helping out in that regard, maybe, helping on the recruitment.
I've already spoken to the state, some people in the state society, not necessarily formally, but, at least, kind of giving them a heads up that we're doing this and how to proceed. And I said, I'll get you a little more information. So me and you will chat, and then I'll review that. I'll get in touch with the appropriate people to at least see if there's any license restrictions or, any type of liability insurance that we need. And then, how to get the word out so we can get, some people there for, whatever you feel like we may need from a manpower standpoint.
Yeah, that would be great. I mean, from experience, I can tell you, at least down south, podiatry and dermatology are always a big draw.
Yep. All right. Well, I know a few of each. I can, maybe start to ask around, see if people, can volunteer. I know some women's health people too. So
yeah. Excellent.
Yeah.
And maybe again, maybe and maybe it's offline. We could pick your brain too, Ed and I, about follow-up. It doesn't have to be podiatry follow-up, but just, what that might look like. What does follow-up mean?
Yeah.
Who pays for it? And we'll be working with RAM to kind of use their experience in that. And in the debrief with the Lynn Clinic, I'll ask them about it too. But to me, that's the area that I know the least about, is how that follow-up is done. And it's such an important piece. So I'd like to start thinking about it.
You got it.
All right.
Yeah, that's awesome. Ed and Jay, again, thank you very much for all the effort you're putting into it. It's going to be awesome, when it happens. And
yeah, Ed Hart and Steve Mitchell too.
Yeah,
it's really this.
Well.
Yeah, my job is really just to make sure it comes together. But these are the guys that are actually doing the legwork. Yeah. So it's appreciated.
Okay, well that's great. Well, thank you for mentioning them specifically by name. Okay.
Sure. All right.
I got a question.
Yeah.
Yes.
Maybe to Ray, in regards to your experience, maybe past experience or the experience in Lynn, do you think we should pick the right location for the clinic?
So we picked Keefe Tech, and they've agreed to it. We've done the walkthrough. I think in my experience a good location for it. It just has a great the layout is in my experience perfect in terms of patient flow. Parking lot is also a consideration. Where are the volunteers going to park? There's
and accessibility.
Excuse me.
Accessibility.
Accessibility. No, it's an older building, so it's not ADA accredited, I guess. Is that right, Ed?
No, it is now. They've modified it is fully accessible.
Okay. Yeah, and it'll all be on that first floor, if you know the layout of Keefe Tech. So I think it's an excellent venue. The one in Lynn, not to take up too much time with this, but the one in Lynn, they had the dental setup in the gymnasium, and then there was the medical clinic that was kind of over on an opposite wing of the building, and then the vision care on another side, and the truck that's grinding the glasses down to fit the frames was in the back, and that all works just fine. But I think what we're going to have is more of a condensed setup where everything is within reach, within walking distance. So if a patient wants to receive 2 services, and in some clinics they can, it'll be really easy for them, even if they have difficulty getting around. So, yep. So, all right.
All right. Yeah. Thank you. Thanks very much. Okay. Moving on to the consent agenda. Anybody like to make a motion to pass that as written, and at least who we can vote as long as we had a quorum. I know it was Ed and I and Jay. I can't recall if Bernadette or Barbara or one or both were or weren't there.
I'll make a motion to approve.
Okay. Any seconds?
I'll second.
Okay. Great. All in favor? Aye, Ron.
Aye.
Bernadette.
Bernadette.
Aye,
Okay.
Barbara.
Okay. All right. That motion passes 5-0. And just as moving on to agenda item number 6, Raj had been kind enough to inform me that agenda items 7, 8, and 9 should actually be under H, I, and J. I would guess, if I know the alphabet, at least half well. So he is going to do A to G, and then 7, 8, and 9 included in his report.
I'm sorry, sir. That'll be under agenda number 6. So it'll be the future discussion.
Oh,
so
those are for future.
That is correct.
Next week. Oh, I'm sorry. So I misunderstood the text. Okay, now I got you. So he won't be talking about those tonight.
Thank you. So should I start with my update? Yeah. Thank you.
Yeah.
So with a childhood vaccine program, as the program is doing wonderful, I guess we have 500 plus vaccines administered by now. There is a clinic tomorrow. I guess 10 plus kids are scheduled for it. So doing great on that part. There is a huge influx of Framingham kids. Our public health nurse, Jessica, I guess she got a request for 75 plus kids from Framingham this week, So we're going to be busy with that, So a lot of vaccines there. COVID-19, as was mentioning Mr. Marcus, the numbers are kind of low. We're seeing a case or two every day, so low numbers, but again, not the real numbers given a lot of people are testing at home, so, but like, I guess, the water results from all over Boston's, the numbers are low, at this point, so some other respiratory things are going on, especially with the kids, but COVID numbers are low, looks like. We do have a scheduled Pfizer clinic tomorrow at the community center. It's from 10 to 1. And we're going to be offering the flu vaccines as well at the clinic. And this is the third clinic for the flu. And we are doing it in collaboration with the Milford Central Pharmacy. First clinic for the flu, we get like 60 shots. The second one, we had 17 of them. Tomorrow will be the third one. Hopefully, we would do some good numbers. Washoe Compound, there was an advisory that we have issued. That we got a notification from state like 3 weeks back that there was some cyanobacteria activity in it. So based on that, we had an advisory for no swimming or not entering the pond water. Last week, they have a negative test that was on 11/9, and they're going to be testing that the water again tomorrow. Hopefully, by end of the week or something, we'll be able to lift that advisory, if that water comes negative for cyanobacteria. Restaurant Crooken, yeah, we had some issue going on. We had a report that they had actually built up an area without permission more in their dining area. Our food inspector, Mr. Karan Tom, here, he was in the restaurant on October 28th, and we did saw that they have a build up, the new area build. And we have asked them, to apply for a permit, both from the health department as well as the building department, and get in compliance. This was last week, me and the building commissioner, we went into the restaurant just to check what's going on. They was operating the area that we have asked them not to, till they have a permission from us. So I have issued a citation of $100 based on that. We are working with them. Again, have written to them that they should not be operating the area till they have clearance, because they did some good plumbing work, electrical work in the area,
What was it? Were they eating there, or were they serve cooking in the area?
Right. So they have actually built up an area for bubble tea. They're making some waffles there and all that. So operational area.
Mm.
So. We are working on it, hopefully get this resolved. Otherwise, I'll bring them before the board, But I just wanted to keep the board posted on that this is what we are dealing with right now.
Okay.
Arbovirus, I guess we had a hard frost this morning, So far, we have 7 cases of West Nile virus in the state. 4 of them was in Middlesex County. 3 of them was in Suffolk, This year, so far, 95 positive mosquito samples. We didn't see nothing with EEE this year, and hopefully with the second hard frost, all the mosquitoes are going to disappear, So I don't think so we're going to see anything from now on, but 7 cases this year. Other than that, we have actually purchased a portable refrigerator with some grant funds we have through the Metaverse Share Services. We actually got a request to do a clinic, off-site, for both flu and COVID. And now state needs, that we need to have a data logger in case we are transporting vaccines. So we thought it's going to be a good idea, so we purchased one. And I'm open for any questions, please.
Raj, I can't ever remember a lower amount of, either West Nile or EEE. Do you? 4 cases in Middlesex County?
I guess last year we had 9,
Yeah.
and some EES, but this been a good year.
Yeah, definitely.
Right. I mean, it might be the thing with the drought conditions we have, we had in this year. But yes, I'm glad, that this is staying low, So.
Yeah, no activities had to be canceled for the the high school students and things like that. So
right.
That's pretty lucky. Hey, just again, is the flu clinic, is that at town hall, or is that at the senior center?
So it was actually scheduled to be at the town hall. So
Okay.
given actually tomorrow there was a lot of paving or road work supposed to happen around town hall, though it might be canceled, or maybe moved to Thursday because of the weather conditions tomorrow. Because based on those, we moved it to the community center. Earlier, I did check at the community center because that's a more ideal location given, seniors coming in, but they didn't have a space availability. But because of the construction, we have to move it there.
Okay. All right. Good to know. Thank you.
Thank you, sir.
Anybody else? No? Okay. All right. I guess since Raj had said moving on to 6, 7, 8, and 9, I guess those will be discussed at our next meeting. Raj, just a question: is the I just can't remember if we did this. Did we do the grease trap waiver thing? I thought I remember us talking about it. I don't know if we have to put that on the agenda, or do you just do that yourself?
I will check, sir. I guess it's done only for the new ones, but I will check. We'll get back to you on that.
I thought we used to do it for everybody, but I could be wrong. So okay.
And I need to check it too. I mean, I will check what historically was done. So
okay.
I'll get back to you on that.
Yeah, not a problem. I mean, if you need to do it, just throw it on the agenda.
Yes, sir.
Okay. You're right, Ron. We always did do that in the past. We would continue their waivers.
Thank you, Laura.
Yes.
Okay. All right. Thanks, Laura. Okay. So Laura, if I'm right, and I think Raj, you were here last year as well. Yeah. Are we having 2 meetings in December, or are we just going to try to have the one?
Last year we just did one, or past we've done one in November, December. But
right.
However, what the board would like to do doesn't have to be that way.
Yeah. Raj, what are your thoughts?
I guess we should be comfortable with one. I only one thing we anticipate. 125 Sudbury Road, we are currently reviewing their septic application.
Yep.
They definitely have some variances to be asked from the board.
Okay.
We actually reviewed their plans. They need to get some revisions done, So I guess we might be able to be good with one, but again, we can decide one and we can ask board in case we have to meet for an urgent issue,
Yeah. Okay, so we'll keep the December 6th meeting, on as is, correct?
I mean, if it is comfortable with the whole board, or your decision, so.
I'm going to unfortunately be in Arizona on the 6th.
Okay.
I kind of feel like I keep saying this, but I've been traveling a lot, and I'm sorry about that.
Okay.
So feel free to have it, or whenever I can come at the Tuesday after that or whatever.
Yeah. No, normally I wouldn't mind waiting, but if there's any urgency to the septic installation waiver, I would want to get that done for those homeowners.
So yeah. I will keep you posted, Dr. Ron, and then I guess we can decide, and we can I'll keep you posted as soon as we have it ready, for board, and then we can go that way. I mean, again, it's all your call, So
yeah, no, but as far as everybody, so Sergeant Berman, Bernadette, Barbara, everybody else should be around.
Yeah, I should be around.
Okay, everybody.
Yeah, I'm around.
Okay, and then I think we should keep it on, even though we'd love to have you, Jay, just to make sure if there's
That's all right.
we need to take care of. Because then I think, you know, by the third week, some people might be traveling and we might not be able to get a quorum if we need something. So just in case.
Sure, makes sense.
Okay.
Wonderful, sir.
Okay. All right. Great. All right. Anybody else with anything? No?
Nope.
Okay.
Can I just say something? I was just, I mean, just going back for Jay, I just checked on that, the REM website that you're checking about. So it is just the REM USA. And then once you get onto it, there's an opportunity to volunteer. And even the Framingham one, it's there on their schedule. So you can select which one you're talking about. So, which is really cool. I had not gone on it, sorry.
Yeah, it's good to see that they've got it up there, and so the person would go on, and then they fill out, it's like a profile, and then they'll ask, you know, which clinic do you want to volunteer for? They'll ask again. They take all your information. If you're a licensed provider, RAM would follow up with you directly and check your license, and they've got a year to, you know, or 10 months to check your license. So it's pretty self-explanatory, but yes, that's the one.
Yeah. So, because I have a few people in mind, and I have a few groups with, you know, nurses too that might be interested. So
yeah,
I'll touch bases with you.
That would be excellent. Yeah. If anybody has any questions, any of your friends or coworkers, Barbara, they can contact me. No problem. You can give them my email address.
Okay. Sounds good.
All right. Or Ed Berman, either one.
Okay.
All right.
That's great. Thanks, Bernadette. Okay. Anybody else? All right. Always the most important motion. Anybody?
I'll make the motion to adjourn.
Okay. Second?
I second it.
Okay. All right. Great. All in favor?
Aye.
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 All right.
Aye.
Everybody have a wonderful Thanksgiving. Thanks to all the board members for all your hard work. And of course,
Bye for now.
Thanksgiving, everybody. Thank you.
Thank you.
All right. Thank you.
Thank you.
Thank you very much.
Bye.
Thank you.
Yeah.
Thanks, Mark. You have a good Thanksgiving too. Okay.
You as well, Dr. Ron. Thank you, Dr. J. Thank you.
Thanks, everybody.
Thank you, Barbara.
Okay.
Bye.
Bye-bye.
Bye.